Hi everyone. My name is Caitlin Valenti, and in my mini presentation is on dissociative identity disorder, or DID for short. So, let's talk about what dissociative identity disorder is. It's a mental disorder where a person has two or more different identities. These identities can act, talk, and feel totally different from each other. So, someone with DID might not remember certain things or feel like time is missing. And it used to be called multiple personality disorder, which you probably have heard in movies, but it's a lot more complicated than that. So the DSM-5 criteria to be officially diagnosed with DID, here are, these are some certain things that have to happen. So a person has to have at least two different identities or personality states. They have big gaps in their memory, especially around trauma or everyday stuff. And these symptoms mess with their life, like work, school, or relationships. And it's not caused by drugs or medical problems. So it's not just someone pretending it's real, it's actually pretty serious. So here are some symptoms. Some losing time or forgetting things like blacking out, feeling like you're watching yourself from the outside of your body, mood changes, depression, anxiety, and acting totally different depending on the identity. So it's like fronting or your identity's in control. So these symptoms can really confuse a person or people around them. So what causes it? Data usually starts in early childhood, especially if the child goes through a lot of trauma. This trauma can physically, like, be sexual, emotional, abuse, and sometimes it's neglect, like not feeling safe or cared at home. So the brain creates different identities to help the child survive the pain. And it's like a way of coping. When things are too hard, they handle it's like a different person. So in this slide, we're going to talk about how it works. So how it works. Each identity is called an alter, and alters can have their own names, voices, egos, and even different likes and dislikes. So the person might not remember what another alter did, like a blackout, and switching between alters usually happens when the person is stressed or reminded of past traumas. So it's the brain way of protecting itself, but it can make the daily life hard. So here are some treatment options. So the main treatment is going to be therapy. So therapy helps the person talk through their past traumas. It also helps on getting different identities to work together as a team. And sometimes doctors give medicine to help with depression or anxiety that comes with it. Treatments take a long time, and it's super important that the person trust their therapist. So, so here are some common misunderstandings. So let's clear up some myths. DID is not the same as having mood swings. It's a real disorder, not fake or made up. Movies and TV shows usually get it wrong or blow it out of proportion. And finally, people with DID are not dangerous. Most are trauma survivors trying to cope. So in this slide, I kind of provided an example. This is a famous movie, and you might have seen it. It's called Split. It's about a guy who kidnaps two young girls, and he has identity disorder. So, but the movie makes the disorder look way more violent and scary than it really is. So most people with DID are not dangerous. They're just dealing with trauma, trying to heal. And movies like this can make people misunderstand what DID really is. So this is a good movie to kind of look at, but don't really take it to heart. And then here are my resources. And yes, so thank you very much for watching, and I hope that you learned a little bit about my disorder. Thank you, bye.